Now, the reason, we spend so much time working it up in our clinic is we want to make sure that we guide Jessica and all of our other patients in the best way to either get that out of their system through, homeopathic detox with Cellcore, or if we have somebody with a bad mold exposure, we have a specific pathway for that. And then I have all these patients, Jessica, like you, that, now you mentioned my book. I published the book about the Sharp method, and I published the book about, breast implants and explant surgery and breast implant illness. So everybody can understand more of how we have, the work we've done and what we have, to share. And now we share Sharp programming, remotely, because like to your point, a lot of people can't come and travel. It's too difficult. They have no help or whatever the situation is. So now people can come, basically visit us by just doing it virtually and working with, my team, Chelsea and Gina and all of our providers that run the detox program. So it is more accessible now, so that, what Jessica's doing with Cellcore is a very important component of how we feel patients should recover. Because if you don't, like, she wouldn't know that she had this chemical in her system. And
it is a lot. And I think with everything just given today's, just our world, whether it's our political climate, our social media, all the things that we're doing, everything is a lot and overwhelming. And so if you can do one thing to start getting you down that journey, and there's so much we can't control, but then there's also a lot that we can control, right? We can control ourselves and what we do and how we choose to make our health a priority. And so I just think of all the money over the years, and even the last couple of years, that I've spent just one-offs, right? Buy this, and you have a symptom and you buy this or buy that. And to have a total complete picture of me specifically, I'm not just shooting darts and hoping it's something for me, but I really felt through this process, and I still do, with your team, that this is designed for me and what I'm going through. And I just feel like it's a better outcome that way, because we have so much information coming at us on the daily, that it's important to say, okay, this is customized for us. And I've sent some friends to you, actually, like you said, just for the blood work and the Cellcore. That's definitely worth it as well. I would say that was the first noticeable thing. I had gotten to where I would try to say something. I'd look at someone and the word would not come to me. So that was really scary to me.